COVID-19 pandemic initiated a breathtakingly suspenseful plot with high stakes. Would the world collaborate and share resources so that everyone would have a fair chance at being vaccinated, or would the richer nations be first in line to get their populations vaccinated at the expense of others? In November of 2020, CARE International launched the Fast and Fair initiative in response to the pandemic, in order to help steer the global vaccination effort down the path of fairness and efficiency. 2.5 years later, in April of 2023, CARE commissioned a study of the Fast and Fair initiative in order to find out where their efforts had been successful and where not. To set the stage for the findings of the study, we need to create a picture of the global vaccination effort at the time. Using a range of 0 to 1, with 0 as a perfectly equal distribution and 1 as perfectly unequal distribution, world COVID-19 vaccine inequality was found to be at 0.91 on June 7, 2021, representing severe inequality. Through the Fast and Fair campaign, CARE sought to impact multiple fronts. CARE noticed early on that while there was talk of the need for richer nations to donate vaccines to poorer nations, few people were talking about the conditions required to actually administer the shots.
What we were really focusing on is what we call tarmac to arm, is this idea of once something lands in a country, that's not enough. The whole point of a vaccine is for a human to be vaccinated. And that what we saw very early on in the vaccine conversations globally, and even at a national level, but especially globally, is that they were all about where is the vaccine, who has the vaccine, who's producing the vaccine, how much are they charging for it? And for months and months, that was really the only narrative that was out there in the world. And very early on, we started saying those vaccines aren't going to be any good if you're not investing in the health workers who get vaccines to humans.
The overwhelming majority of our healthcare's health portfolio works intimately with health workers who, of course, as we all know, are predominantly female and who have absolutely the least power in the whole system before you get to, the community.
How did Fast and Fair plan to make a difference? Primarily through a broad advocacy campaign, which included working with partners to request funding from the U.S. government for global vaccination efforts, and through publications designed to bring concrete numbers on the true cost of vaccine delivery in low-income countries. So, after 2.5 years of effort, how did CARE do? Using the contribution ranking method, it was found that CARE was largely successful in leveraging its data, advocacy prowess, and local-to-global presence in achieving systemic impact, particularly in catalyzing material support for vaccine delivery.
The vaccine cost methodology really allowed us to change the way we were having conversations, particularly around the importance of investing in vaccine delivery and the importance of investing in frontline health workers. It allowed us to have some very data-driven conversations that were supporting advocacy around the importance of frontline healthcare workers and what the stakes were if we didn't invest in them.
I think CARE did a lot of really excellent research on also the care burdens that were being put upon frontline health workers and the disproportionate effect on women. I would say overall, I don't think that the vaccine response actually was equitable. I think NGOs and the coalitions that sort of formed around vaccines to call for the people's vaccine, the common demands, were helpful in elevating the issue and in ultimately getting more funding for international at a time when it really could have been focused just very much on domestic.
To a lesser extent, CARE also catalyzed global support for frontline health workers.
When we're working on this document, we also come across CARE publications focusing on the female frontline workers. So we also add this component to our Q&A document because we didn't really thought of it when we work on that. But when we, after going through and we do realize the importance and also understand the work that CARE did, so we also add this component and emphasize this area in our document.
Primarily because of the flawed design and scale of the global effort, CARE's impact on the overall effectiveness and equity of the global vaccine effort was low.
We had a system that was premised on rich countries sharing and doing so sort of in real time. And I think that was just politically completely unrealistic.
But this should not minimize the significant successes of CARE's Fast and Fair program. CARE's efforts did, no doubt, result in large numbers of vaccinations, as well as frontline workers that were protected and paid.
One of the two things that I'm proud of, so which are one, reaching populations that are hard to reach, and two, reaching women. And because of the work that we have been doing, because of the work that CARE did, we have been identified to spearhead COVID vaccination in 3 hard-to-reach populations.
I'm most proud of the way we were able to bring all of the parts of CARE together to deliver on this work, and the way we were able to shift from local to global and back again very, very quickly.